Welcome to On the Beat. Today I am joined by doctors from Gastroenterology Associates of Columbus and Starkville. Sitting with me today is Dr. Ricky Johnston and Dr. William Gillespie. And a subject that I'm very interested in because I was telling you before we started this, my mom suffered from them, but ulcers, stomach ulcers. So what is a stomach ulcer?
Ulcer is basically just an area, so your stomach has a lining to it and to protect it from acid. And so an ulcer occurs when you get a little bit of breakdown in the lining of the stomach, and it just creates kind of a little divot or excavation there, and it kind of erodes down into the deeper layers of the stomach wall.
And the pain? I've never had one before.
And that's the most frequent probably complaint we see with ulcers is pain, but sometimes people may not have pain with them. They may come in for they're anemic, or they've just been passing some blood, in their stool, and then we end up finding an ulcer as an explanation for that. But pain definitely is one of the more common.
And so everybody wants to know too, how do I get one of these? And we were laughing before we started, but my mom always used to say that I gave her an ulcer.
Yeah.
So
yeah, the most common cause of an ulcer is a condition or infection called H. pylori. It's a bacteria that lives everywhere in the environment, and lots of people have this infection in their stomach and don't realize it. And it can just over time causes ulcers and can increase your risk for stomach cancer. So we always check for this infection in anybody that has any evidence of ulcers, and we treat it if they do have it. The other most common cause that we see are people taking over-the-counter pain medicine, NSAIDs, like ibuprofen, Aleve. The worst one is BC powder, but those things will
that's my go-to. Yeah. Oh no.
Yep, those will tear up the lining of your stomach and give you ulcers and things like that.
Just to add to that, even a baby aspirin, a lot of people think, oh, I'll just take an coated baby aspirin, 81 milligrams. That's enough to cause an ulcer as well.
Okay, and then what is the treatment if I have ulcers? When should somebody come to you?
Well, if they come to us and we diagnose an ulcer, if they come for one of those reasons we mentioned earlier, maybe they're having symptoms or we're doing an endoscopy, and that would be the way to diagnose it, is if you do have an upper scope where we run a light down and look inside the stomach and actually see an ulcer. Sometimes you can diagnose them on x-rays, but an endoscopy is the best way. So if you do have an ulcer, then basically we just help the body heal itself by lowering the acid levels in the stomach. So when you lower the acid levels in the stomach, that allows the lining to kind of regenerate and heal just like any cut on your skin would. But the high acid levels in the environment and in your stomach, that environment prevents it from healing, so we lower it and it heals on its own. Plus, if we have the H. pylori, like he mentioned, we would definitely want to treat that.
And it may seem like a silly question, but what type of pain am I going to feel?
It's generally pain in the middle upper abdomen.
Okay.
It's not down low, it's kind of up here right below your breastbone where the stomach is. But it can also cause kind of vague pain other places, but the traditional classic one is kind of in the middle in the upper stomach.
Now you mentioned the NSAIDs. What are other things that I could do to avoid getting an ulcer?
Well, again, it's avoiding all those NSAIDs if you can. Taking them every once in a while is fine, but you don't want to do it every day.
Okay.
And then there's not necessarily specific dietary things, but it's essentially avoiding NSAIDs. We treat that infection if you have it. And then if you do have history of ulcers or really bad symptoms like heartburn, reflux, we'll usually put you on a medicine to lower the acid. And that will generally help prevent you from getting ulcers.
And stop smoking.
Good.
Yes.
Good tips. Thank you both so much. That's today's On the Beat.